Hi, everyone. Welcome, and thanks for joining us to the ARC of Fort Bend County's Parent Education and Support Group meeting today. We're virtual. My name is Carrie Axtell. I'm the Advocacy and the Youth Programs Director here at the ARC of Fort Bend County. And we're a nonprofit organization dedicated to grassroots advocacy, family support, and we provide a wide range of social and recreational programs for youth, teens, and adults with intellectual and developmental disabilities. If you'd like to learn more about us, our mission, our programs, you can visit us at our website, arcoffortbend.org, and follow us on our social media. We're pretty active on our social media channels of Facebook and Instagram. But throughout today's presentation, please feel free to type questions that you have in the chat box, and I will share them with our presenter at the end. If you'd like to ask your question in person at the end, you're welcome to, but we'll go ahead and let our presenter, Terry Anstey, do the full presentation because he might answer some of those questions that you have throughout the presentation. So without further ado, it is my pleasure to introduce Terry Anstey. He is the supervising attorney for the Community Integration and Healthcare Team with Disability Rights Texas. As the federally mandated protection and advocacy agency for people with disabilities in Texas, Disability Rights Texas plays a vital role in ensuring access to essential services. In addition to supervising staff, Terry represents children and adults in Medicaid-related cases, including administrative hearings for denied or reduced services. Before becoming an attorney, Terry spent 10 years as a registered nurse, bringing a unique and valuable perspective to his legal work today. So today, Terry will be sharing important insights into the understanding Texas Medicaid, and it's a topic that impacts many of us and our families. So please join me in welcoming Terry Anstey.
All right. Well, thank you very much. Thank you guys for having me. It's an honor to present today for you guys. So we'll start with this first slide here, understanding Texas Medicaid. And you notice there's an asterisk there because at the bottom, the asterisk says at least some of it. So Medicaid is a very complex and expansive program. There's a lot of different ways that people are able to get Medicaid. These are just some ways that I think are important for individuals with disabilities to understand and to have information about. So this is what we'll try to cover today in this presentation. We'll cover some of the coverage groups for Medicaid for the elderly and people with disabilities, also known as MEPD. We'll look at the eligibility criteria for some of those categories. We'll talk about how to maintain Medicaid coverage, appeal process if Medicaid is denied, and questions. I think we'll have time for questions. Here are some of those common coverage groups for Medicaid for elderly and people with disabilities, or MEPD. Another asterisk, there are many other categories, but we don't commonly see them. And so I tried to cover just the ones that we see most often. In the past, we didn't really do at Disability Rights Texas, we didn't really do a lot of Medicaid eligibility hearings or assistance for Medicaid eligibility. But when the pandemic had a continuous Medicaid coverage, and then that continuous Medicaid coverage was ending, you may have heard that referred to as the unwinding. We started getting into assisting people with Medicaid eligibility issues, people with disabilities. And so we've probably been doing some Medicaid eligibility stuff for about 2 years now. And I had a conversation with one of my attorneys not that long ago, and they were kind of concerned that we weren't going to keep doing it. I said, don't worry, we are going to keep doing it. We saw how important it is. We saw where we could be helpful with this kind of these kinds of issues. And so it's here to stay on the Community Integration Healthcare Team at Disability Rights Texas. Now, we don't do Social Security, but we know some about Social Security in order to point people in the right direction and things like that. So again, these are some of the common coverage groups for MEPD. SSI, Supplemental Security Income, when disabled adult child. We'll talk a little bit more about these separately. Something called the PICL, the Title II Cost of Living Adjustment Disregard. That one's very confusing, I'll tell you that now. I don't even think we've ever come across somebody that actually is eligible for pickle, but it is interesting and something that might be a category that you would want to look into. Institutional Medicaid for those that are in nursing homes or ICFs, intermittent care facilities for people with IDD, 1915C waiver programs, and then the different Medicaid buy-in for adults and Medicaid buy-in for children. Let's talk a little bit about supplemental security income eligibility. Now, most people are pretty aware of what SSI is. It gives monthly payments to people with disabilities and older adults who don't have a lot of income. The disability criteria does differ for those who are, like, for example, birth to 18 or 18 or older. Now, 0 to 18, the part of the disability criteria is severe functional limitations. And of course, there's income limits too. But when somebody is 18 or older, the severe functional limitations is not the criteria anymore. Instead, it's inability to do any substantial gainful activity, essentially that they can't work or work to provide enough money for them to live. And that's why you may have experienced at some point, if you have children that have been younger than 18 that were receiving SSI and then have to continue receiving SSI at age 18 and older, that they have to reapply for SSI because of that different criteria related to the severe functional limitations when they're under the age of 18 versus the inability to do any substantial gainful activity once they're 18 or older. And the resource limit for an individual is $2,000. The top, as of January 2025, the top amount of SSI is $967 per month. That's up from $943. And what's really important, or what's very important, is a person eligible for SSI is automatically eligible for Medicaid in Texas. Disabled adult child. This one we see a lot. And it's fairly easy to understand versus the next slide, which is going to talk about the pickle exception, or the pickle category. The disabled adult child, or what we call DAC, it helps people be eligible for Medicaid who are denied SSI or can't get SSI due to an increase in Social Security benefits like retirement, survivors, and disability insurance. That could be a parent retires and then a certain amount of their Social Security is then given to the child, and that bumps them over that $967 for the SSI. Now they can't get SSI anymore. They can't get Medicaid because they lost their SSI. That increase in Social Security benefits causes that. But there is a category that allows that child or adult child to be able to receive Medicaid, even though they're receiving over the SSI amount. So the criteria is it got to be at least 18 years of age. They have to be deemed to be disabled before the age of 22, and they're denied SSI because of the receipt of or that increase in the RSDI benefits, and they meet current SSI criteria, not including the RSDI. And we have seen over and over again over the last few years that we've kind of been really working with Medicaid eligibility issues, that Texas Medicaid does a very poor job of checking for this category and approving people for it. Well, we're not sure. The computer system that the state uses, I think it is a company called Deloitte, and it's an eligibility system. And we're not sure exactly how it works, but we know that there are flaws in the system, and it may not be able to pick up within their system that somebody would be eligible for a disabled adult child. We're not 100% sure, but that's what it feels like. Somebody may apply for MEPD Medicaid, and then they'll get a denial letter that says, well, you haven't worked a qualifying quarter, or you're not in a Medicaid waiver. Well, if you didn't work a qualifying course because you're not working, so you can't get the Medicaid buy-in for adults, for example. Or if you're not in a Medicaid waiver, well, you're not in a Medicaid waiver, but they don't have any kind of, a lot of times the notice doesn't have anything about disabled adult child, which makes us think that the system doesn't really test well or even pick up the disabled adult child criteria. This is the pickle. This one, like I have on the slide, this one gets confusing. Like it's really complex. And I've never come across anybody that's considered quote pickle, but I'm sure it happens. But it's very interesting, narrow criteria. Somebody was telling to get SSI and OASIDI at the same time, anytime after April 1977. So it's like you were able to get one check and the other check in the same month, sometime after April 1977. You're still eligible for OASDI. You currently can't get SSI and has an income that will qualify a person for SSI after deducting all these cost of living adjustments. There's like, you gotta like, there's different steps. And if they fail one step, they're out. If they get to the step where they're actually in, then they multiply it times a certain decimal number. And based on whatever year they stopped getting something, and then that sees whether they qualify. Again, it's confusing. I've never seen it, but it is something that I think, is important to know. Institutional Medicaid. These are for people who are in nursing homes or in those ICFs or institutions for mental diseases. The criteria, you have to be there at least 30 days. You got to meet certain financial criteria, which is, like resources, for example, can't be any more than $2,000 for a single person and $3,000 in resources for a couple. And that's not very much. So a lot of people get tripped up on this, like they can't be in a nursing facility and get the institutional Medicaid if their resources are above, for example, that $2,000 for a single person. And the monthly income limit is going to be 300% of SSI. So to get to that amount, you just take the top amount of SSI, which right now is $967, and you multiply it times 3, which ends up being $2,901. So you can't make that much in a month and be eligible. They can't make over that amount and be eligible for institutional Medicaid. 1915C waiver programs. Typically, the way this works is you're eligible for the program, and then because you're eligible for the program, you are able to receive Medicaid. The rationale is that person would be eligible for Medicaid if they were in an institution, but they're living in the community and getting the services that they would get in an institution through the waiver program in the community, and that they would be eligible for Medicaid if they were in an institution. Some of the waiver examples that I see most often are STAR Plus HCBS or STAR Plus waiver, medically dependent children program for those children birth to 21, the class waiver or community living assistance support services, and HCS, home and community-based services. Medicaid buy-in for adults. This is a low-cost Medicaid for adults with disabilities who work. They have to have a disability, they have to work and live here in Texas, and they can't live in an institution or a nursing home all of the time. I guess because it says that, they can live in for a portion of the year maybe, or a small amount of time. They just can't live there all the time. Otherwise, then they would be, potentially eligible, I guess, for institutional Medicaid. The financial guidelines, they look at earnings before taxes. I think you can't make any more than $3,138 per month. You can't have any more than $5,000 in resources. So the resources are relaxed a bit. Instead of it being 2,000, can't have any more than 5,000. And it's probably they do that because they know if somebody's working, they're going to have more resources, and it's probably an incentive for people who are working to be able to receive Medicaid. And an incentive for that person to continue to work. And some items are excluded, from those financial limits, but I didn't want to get too far into that. And then it's a buy-in. So there's a premium that has to be paid every month in order to receive the Medicaid. I don't think it's a whole lot of money, but that monthly payment is going to be based on that person's income. And then there's Medicaid buy-in for children. This is a low-cost Medicaid for children with disabilities, whose families, they make too much money to get Medicaid, they make too much money to get SSI. This one's good if, you're not in a waiver program, the kid's not in a waiver program. The income limits used to be really difficult to figure out. They had like in the Texas Administrative Code, they had like 150% of this and 300% of that. It never really made much sense to us. But recently, they have changed the website and they've put a handy chart that makes it a lot easier for us to understand what somebody's annual income limit could be, and what the annual limits are for the yearly income to kind of point people in the right direction on whether or not they would likely be eligible for the Medicaid buy-in for children. Basic criteria: you got to be 18 years old or younger. They have to have a disability, and they have to be a U.S. citizen or qualified non-citizen in Texas. If the monthly income limit for a family one is 3,765, you can multiply that times 12 to figure out what the annual income would be. In order to figure out, whether or not, because a lot of people, they'll tell you what their annual income is, and then you have to kind of break that down into monthly. And then the monthly payment is going to be dependent on a few different factors. The website talks about income, whether or not you're getting employee-sponsored health insurance, and whether or not they're participating in the Health Insurance Payment Program, or HIPP. Maintaining Medicaid coverage. Now, this one's very important. I don't know 100%, but it feels like the COVID pandemic, when they paused the Medicaid recertifications for like 3 years, I think that some people forgot that they got out of the routine of renewing their Medicaid every year. And they forgot that they had to do it all the time, each year. And so maybe they, got out of the habit of doing it for their children or for themselves, if they're, an adult with a disability receiving Medicaid in these different categories. Typically Medicaid has to be renewed annually. You'll get renewal requests or reminders from HHSC. They have to be responded to. Some people, they get them and then they're like, I don't understand it, and that's an issue, of course. Or it may get ignored. That's never a good idea with HHSC, especially because, and I've heard so many stories about people are like, well, I got something from HHSC. They told me they need 3 months worth of bank statements, but they by the time it got to me, the deadline isn't 3 days, 3 days from now. And I don't have a lot of time to get all this together. And they won't let me go online, and I have to go to the bank, and I don't have enough time to do all of this. What I always say is, yes, that's a problem, but please just do the best you can, put it in, and if you still get denied, then you can appeal, and then you can still give them that information. And a lot of times in those kinds of cases where it's a missing information type situation, then HHSC or Texas Medicaid will take that in consideration, will still approve it if they have all the information that they needed. I've seen plenty of that over the last few years. It doesn't make it easy, and it's still a pain, but it's something that you can keep in mind. While there are those deadlines, as long as you get that information to them, things usually will work out if you go through the process. You always need to keep your contact information updated with HHSC. Report any changes in circumstances, like a different number of people in the household, changes in income, things like that have to be kept up to date with HHSC. And there's different ways to, keep up with those types of things. You can renew Medicaid with the Your Texas Benefits website, which works which works well for some and not for others. Sometimes I've heard stories about people uploading documents on Your Texas Benefits, and then they get lost or get uploaded, but then somebody at, Texas Medicaid or 211 can't access it or something like, I've heard all kinds of stories about that. So Your Texas Benefits is not always working well. You can also renew Medicaid through the mail or through fax, or people can also go to their local HHSC office. There is an appeal process if you're denied. When you get a denial letter of Medicaid eligibility, it can be appealed by calling 211 and asking for that Medicaid fair hearing or that appeal. Same thing, Medicaid fair hearing and appeal is interchangeable. Have that denial notice ready because you got that case number on there. You have other information that they may ask about. The problem, though, is that people at 211 are not always educated and helpful. I've heard plenty of stories about people getting talked out of their appeal rights. Oh, no, you don't want to appeal. You were denied and you're denied and you can't do anything about that. Or you should just reapply because you'll get to a resolution quicker if you reapply for Medicaid. Now, that's not always true. And my thought is that if you appeal and you're actually correct, sometimes they'll look at the appeal even before the hearing date and will resolve it for you. Or if you ask for an appeal that puts pressure on Texas Medicaid to hopefully do the right thing if they're wrong. I mean, look, Texas Medicaid is right sometimes. Like sometimes people have too much resources and they don't qualify for Medicaid because of that. Maybe they have $10,000 in the bank when the resource limit's $2,000. Now they might be able to do something with that money in order to become Medicaid eligible. Of course, you got to be careful with that because if you do something you're not supposed to do with money, then there could be penalty periods. You can't apply for Medicaid or receive Medicaid for 3 to 5 years. And so you have to do the right thing with money in those kinds of situations. Now, we don't get too far into that kind of stuff. But I know, like, for example, you can put money in an ABLE account and that will, not incur a penalty period when it comes to Medicaid eligibility. But with 211, the best advice is to stand your ground. Don't let them push you around. Don't let them say, you know what, you can't have an appeal, or you should just reapply, or you're not eligible and there's nothing that can be done. Stand your ground. And if you get somebody that's just being difficult at 211, or you guys are just not vibing, they're not seeing eye to eye, and they're not listening to you, you can always hang up and call again and try to get a different person who is more amenable to what you're asking for. And the denial notices, unfortunately, they're not always correct. They're difficult to decipher. There's a lot of citations to Texas administrative code rules that don't always make sense. So that can be a problem. But exercise your right to appeal. After you request an appeal, you get a hearing date and time from the hearings office, usually within a couple of weeks. Request a new hearing date from the hearings office if you need more time to prepare for the hearing. Texas Medicaid is supposed to send you an evidence packet that they plan to use in the Medicaid fair hearing to defend their denial decision. If they're wrong, then gather and send hearing evidence before the hearing date. You can send that to the hearings office. Sometimes Texas Medicaid will fix the issue before the hearing or even at the hearing. You get there in the hearing, they're like, oh yeah, we messed up and we fixed it. Let's just, they'll say that at the beginning of the hearing and it might be over. If you need help, sometimes you can ask the HHSC ombudsman to get involved and maybe you can help get a resolution that way. And if you want Disability Rights Texas assistance, we have an intake line, 1-800-252-9108, or an intake can be done on the web at intake.drtx.org. For basic questions, I am available for emails or calls, and that is my email and my phone number, TANSTEET@drtx.org. And my phone number is my direct line is 832-681-8214. And that is all of my slides. And let me see.
Great. I've got some questions. I don't see any questions in the chat at the moment, but if you guys have your questions and you want to either put them in the chat or, unmute if you want to ask some questions. So I've got a couple for you, Terry.
Sure.
So during one of the parts where you're talking about applying for Medicaid, and you're saying that there's these different criteria that you can fall under. So like DAC or institutionalization or waiver program. So when you are applying for Medicaid, do you state that, oh, I'm applying for Medicaid because I'm a disabled adult child, or I'm applying for Medicaid because I qualify for a waiver program? Like, is that part of the application process, or how do they know which one you fall under?
I wish it was that easy. Unfortunately, it isn't always that easy. Like, for example, the Medicaid application that's typically filled out for a lot of these categories is called the H-1200. H as in Harry, and then 1200. And it has a few categories on there, but it doesn't have all the categories. Like, for example, it doesn't have a checkbox for disabled adult child. It has I think it has a checkbox maybe for if I recall the Medicaid buy-in for adults, but it doesn't have and there's a different application for the Medicaid buy-in for children. But it's not super user friendly, no. But what the system is supposed to do is they're supposed to get that Medicaid application and they're supposed to evaluate you for all the different categories. However, I'm not 100% sure on this because I don't work at Texas Medicaid, but I think that the system they use doesn't do a good job of evaluating for all those categories when that H-1200 is processed.
Hmm. So is there a strategy that you would recommend to help people? Is there a notes section or something when you apply for Medicaid to say, hey, I'm a disabled adult, this is an application for a disabled adult child, or?
I tell people to write that on the Medicaid application if they can, and also, especially for the disabled adult child category, to include like the latest SSA award letter, the Social Security Administration award letter that perhaps shows the amount of money that they're getting in RSDI that's above SSI. And sometimes that letter will say, you can't get SSI, now, or you're not getting SSI anymore as of a certain date, and now you're getting this higher amount of Social Security benefits. That letter would be really helpful to send in with the Medicaid application to kind of clue Texas Medicaid in that this is for, that this is for a disabled adult child category.
Okay.
I do recommend that. If for whatever reason that doesn't work, then you can always talk to the ombudsman and say, hey, look, I meet the criteria. I'm at least 18. I was disabled for the age of 22. Here's the SSA award letter that shows I'm getting a higher amount. I lost SSI or I'm not eligible for SSI because of, for example, a parent dies, and you get survivor benefits, or a parent retires and you get retirement benefits or disability benefits from a parent who's now receiving disability, and those bump you over the SSI. That SSA letter will usually have that information, and that's a good tool to turn into Texas Medicaid to say, hey, look, my child is disabled adult child category.
Okay, great. Go ahead, Judy. I see you got your hand raised. Go ahead.
Thank you so much, Carrie. And Terry, love Disability Rights Texas. You all are just a phenomenal organization. Thank you for having this webinar. I work for Family to Family Network in Houston, and what we do, Terry, is we always tell families on each page of the H-1200 application, write in red ink, disabled adult child, and then in parentheses, DAC on each page. That usually helps. Usually, I can't say for sure with everything, but it usually helps, but you have to write it on each page.
That's good advice.
Yeah.
I think that's really good advice. Is it kind of sad that somebody has to do that in order for their application to be processed in that way? Of course.
Very, very sad. It's so complicated, but that is what I have been told. And fortunately, I didn't have this issue of getting Medicaid because my son got SSI when he was 18. And so we have not had an issue. But yes, that is what we tell families. And generally, it seems to help. That was a comment. My question for you is, when you mentioned about, like my son gets the 967, whatever it is now, and he works fortunately. So he also has RSDI because he earned enough work credits. But when his dad retires, I have to then contact Social Security and say, okay, his dad has retired. And we want to now draw on that. How does that work where they get that higher amount? And how do I prevent his Medicaid from getting dropped? You
So,
mentioned that on a slide, and I think I didn't comprehend it.
so I don't deal a lot with Social Security. We
Okay,
don't do Social Security work, so it's hard for me to know exactly how
okay,
that part would work. I know eventually, for example, if when your husband retires and your child receives a higher amount of benefits, SSA, I don't know if they do that automatically. Sometimes it feels like
mhm,
SSA does it automatically. Like
okay,
you're now going to start receiving this amount of benefits, and this is when your SSI will stop. Once
yeah,
and then Texas will get a notification from the Social Security Administration after that letter that says, this is the day that SSI is going to stop. And then Texas will say, okay, this is when your Medicaid's going to stop. Well, if
okay.
that happens, then you fill out that H-1200
H 1200, okay.
and
Yep,
then do the whole DAC situation.
got it, got it. Okay, thank you so much for all you do.
Sure, thank you. You're very welcome.
Okay, and we do have a question in the chat.
Okay.
Paola, she says last year she applied for SSDI for their 18-year-old son. They went to the office and they told them that he would not be eligible because they needed to have a green card for 5 years. They've had their green card for 2 years. She says they never sent us home a written denial. We didn't receive anything. What do we do here? Is it possible to have Medicaid with having a green card almost 2 years? Do you know anything about that? I know it's kind of
I
combining a couple
don't.
different situations.
Yeah, there's some immigration issues in there, right?
Yeah.
So I don't have the answer to that question. There are like categories if they're I I think maybe if people are legally, legal permanent residents,
Mhm.
but I don't know that off the top of my head about how long somebody needs to be a legal permanent resident before they can receive Medicaid. So I'm sorry, I don't know that off the top of my head. I
Okay.
can see if I can. So did you apply for SSDI or SSI?
Uh,
I think, hi, nice to meet you. I think it was uh, SS disability. Yes, SSDI, I think.
Well, SSDI will be for for somebody who has worked usually,
Ah, okay, okay.
or they get benefits because of a parent or something like that. So I'm thinking that you're actually talking about SSI. Maybe your
Probably.
son
I don't
can't
remember
work.
because I don't remember and all this. Yeah, so perhaps yes, but we went there and they say, hey, no, you need to have the green card for 5 years, and so they I don't know how to apply if I don't have a written denial, so they never send us at home anything.
It sounds like they just provided you information with that you couldn't get, SSI until he had that, green card for 5 years, rather than, go
Yeah,
through
yeah,
the
yeah. No, no.
process.
Yeah, yeah.
So I don't, like I said, I don't know, because the SSI is going to be separate from, necessarily kind of separate from Medicaid eligibility in Texas. Like if you can get the SSI, then you're automatically eligible for Medicaid in Texas,
Yeah,
right?
is it possible
But
to have a Medicaid if you
I'm not 100% sure. I don't know that off the top of my head. So you're saying whether or not somebody has a green card for 2 years, could they still get Medicaid in Texas under a different category if they don't get SSI? Is that what you're asking?
okay, thank you.
Yeah, I mean, if that's what you're asking, I don't know the
Yeah,
answer.
yeah, yeah.
Yeah, that sounds like what you're asking. I don't know the answer to that off the top of my head. We don't do a lot of we don't do immigration, so we don't get into that situation very often. I can if I find some time, I'll try to sit down and look at it and maybe send Carrie some information that she might be able to send
Thank
to
you.
you.
yeah,
Thank
yeah. And I'm curious, so maybe even some of our helpful immigration nonprofits or people that's mainly what they do is, immigration issues. So I'm thinking, Pill, I'll get with you offline and try to maybe find some surely there's got to be nonprofits that help with immigration issues too, and that might be something that they have come across and might have some good resources and information for you.
Thank you. Thank you.
Sure, great question.
As far as Judy's question, she said that she wanted some information about or ask questions about Medicaid buy-in for children and adults. I think the best thing I can give you is the information on the HHSC website. It doesn't really have information about who to contact if you have questions necessarily.
Yeah, it's because as you mentioned, 211, it's a hit and miss.
It's definitely a
And,
crapshoot with 211.
Yeah,
I can put in
and
the chat the different HHSC websites for the Medicaid
yeah,
buy-ins
and
to
those
see if that
websites
helps.
they're not, I don't know. They're
I
not the
mean,
most helpful.
they do have the you know, the a link to the the applications for it and that type of thing, which can be helpful. Let me see, and I'll drop these HHSC websites in the chat. It's,
Thank you.
how helpful that might be. But my advice, if you have questions, is either the local HHSC office or perhaps the ombudsman may be able to answer questions, or unfortunately the crapshoot that is 211.
Yeah, so for 211, the appeal time frame, do you recommend then people just do a paper appeal then rather than mess with 211 or?
But see, the problem though is that with the Medicaid denials, they don't have a paper. I don't recall there being a paper way. They really want you to they point you to call 211.
Force you, okay.
And so unless they have a, I can't remember, but it always felt like they always wanted you to call 211 to get the appeal.
Gotcha. And then if you are appealing, does your money or I'm sure your Medicaid eligibility continue in the meantime while you're waiting for the appeal, or does it pretty much you don't have your Medicaid?
Sometimes there's a gap. It depends on whether Texas, processes it correctly and in a timely manner, because the SSA will say, okay, SSI is going to stop on this date. And then it will stop, and then Texas will stop the Medicaid on that same date. And so sometimes there'll be a gap between when SSI and Medicaid stops and when DAC. They don't have a good. To me, it feels like they don't have a good system for transitioning people from SSI to DAC, and their Medicaid eligibility there could be a gap there. But while there might be a gap, there may not be a gap. Whenever Texas Medicaid does approve DAC, sometimes they'll approve it and backdate it. For example, I have a client who called me I think on February 10th. And by the time we got everything straightened around for me to write an email to Texas Medicaid about this person is DAC. Come on, guys. This guy's 48. He was disabled before the age of 22. His dad retired. That's why he's not getting SSI now. He's DAC. So he got that denied. I think his Medicaid ended at the end of January. And I was able to write to Medicaid I forget what day, sometime in the middle of February this year. And he got approved. They told me he got approved, and they backdated it to the beginning of February. So February 1st ongoing. So even though there might be a gap, then they could backdate it to fill that gap. That I've seen that often. Although sometimes they still mess things up. And one person that I helped, they're DAC, but they're going to start it in April, and I can't figure out why. But so sometimes they backdate it, sometimes they don't, and sometimes it feels like I can't really figure out their process on why they decide. Some people get backdated and some people start at a different date. So
maybe something to ask about during your appeal process if you wanted it to, if you think you're gonna be in that situation.
Yeah, you could always ask the hearings officer for it to be backdated, or that type of thing during the hearing. So somebody had to put a comment, and I was going to look at it. DAC receiving SSA survivor benefits directly deposited in a checking account. She's in Medicaid waiver, lives in a group home. Checking accounts now shows more than 2,000 because SSA total month amount was not spent each month. Renewal was sent in recently. Will amount over 2,000 impact Medicaid eligibility, even though the monthly amount is less than 2,000? It can, but potentially it can. If they catch that and then they send you a denial because the resources were over $2,000, then that could potentially cause a problem. Yes, that could cause a problem both with the Social Security Administration and Texas Medicaid. You got to be real careful with those resource limits to make sure that that money gets spent down within the checking account. Now, if for whatever reason there isn't a problem with Texas Medicaid, you can always show them, like you can always appeal and then show them, hey, we spent that money down. And you know, sometimes it can get resolved in that way once it gets below 2,000 and you show them it's below 2,000.
So would opening an ABLE account potentially, and I don't know how old this disabled adult child is, because I know ABLE accounts have a age limit too. You can't, once you're after a certain age, you can't open an ABLE account because you're
Right.
a senior, and yeah.
Sometimes you just need to spend that money down. Like if it's just a little bit over 2,000 for that month and they catch it, then you can just spend that money down, like, you know, on whatever they allow you to spend the money down. I can't remember it off the top of my head, but yeah, that can usually get resolved, I think. But you just got to be really careful with the resource limits to make sure that you don't have a checking account that goes over $2,000 during the month. Somebody asked, Melody asked, I have a disabled aunt who is 66. She was disabled as a child. Her parents are deceased. What does she qualify for? Is it SSDI and Medicare? It's hard to say. Again, I'm not a Social Security attorney. She would have to apply. Sometimes they get SSDI because they worked. They have to apply for it though. And then Medicare, you can get Medicare if you're before the age of 62 or 65. If you get SSDI before those ages, then you can't get Medicare until 24 months after you apply for SSDI, unless you're of age to receive Medicare. Like, you know, I think it's 62 or 65. And so if it's before that age, then you have to wait 2 years after applying for SSDI to be eligible for Medicare. Actually, they kind of like automatically enroll you in Medicare, like 25 months after you've applied for SSDI and started receiving it. I think that's right.
Okay. So, but as far as Medicaid, this person, her aunt, would apply for Medicaid.
I mean, it depends on the situation. You
66
know,
because
you have
she-
resource potential resource issues. You know, is she in a waiver? Is she in an institution?
Mhm.
You know, hi Melody, go ahead.
So my aunt, she's never worked. She was disabled as a child. She does have Medicare, and I think she has some Medicaid, but I think she was on a waiver plan and she got dropped from it for some reason. So that's why I was just asking, like, who do I call to see what she qualifies for? So I have her on the right one.
Huh. I think for your aunt, probably the best resource would be like area agency on aging and get like a benefits counselor to kind of talk with you and talk with your aunt. And then they could look and determine whether, you know, what she might be eligible for. Benefits counselor would be a good resource.
Is there a link for that or a
It
contact?
depends on where you are, you know, like,
Houston.
but you kind of just have to find, you know, like the area agency on aging website. I'm trying to remember which, you're in Houston, you said?
Yes.
Houston Area Agency on Aging. There's a Houston Galveston Council. Their websites are not super user friendly, to be honest. But they do have, like, they have benefit, like they talk about benefit checkups. A lot of times they'll have information about benefits counselors and things like that. So you may search Houston Area Agency on Aging and see if you can find that.
Okay. Thank you.
Sure. Does anybody else have any other questions?
And then another thing I was looking up for Poland, a potential resource here. I'm going to put it in the chat. So there's Houston Immigration Legal Services. They may be able to help with some of the, because it kind of is this intersection of immigration and legal rights and benefits and entitlements, they may be able to be a good resource for you. And I'm trying to copy their
Catholic Charities may be a resource as well.
yeah, that's another one. I didn't think about them. You're right.
Sometimes the Legal Services Center funded organizations may be helpful in this kind of situations. But they're income based. So like in the Houston area, that would be Lone Star Legal Aid.
Yeah, and we do have a Lone Star Legal Aid branch out here in Fort Bend. It's in Richmond, so there is a Lone Star Legal Aid as well. But I was thinking specifically for immigration type issues, I think maybe try this HoustonImmigration.org. There's their hotline there, Paula, for questions. They may be able to give you some guidance.
Thank you.
Yes. All right. Well, great questions, everybody. I am going to send out a copy of this video and Terry's slides, his PowerPoint presentation. So what I will go ahead and do, we'll sign off for now, and you'll get a recording and the materials in your email. Thanks so much for joining us today.
Thank you for having me, guys.